acting in a coordinated manner, close this wound. The platelets are responsible for first sealing of the tear, then a number of coagulation factors are activated, leading to the formation of fibrin strands which stabilize the growing clot. Thromboembolic disorders can affect both types of blood vessels. Arterial, or white clots, are primarily triggered by the rupture of an atherosclerotic plaque. Arterial clots are platelet rich. Venous, or red clots, on the other hand, mainly consist of red blood cells and fibrin. Vascular injury, hypercoagulability of the blood, and venous stasis, Virchow's triad, play a crucial role in their development. It's important to note that the formation of both types of clots, arterial and venous, always involve platelets as well as coagulation factors. So let us go back to our pathophysiology. When we talk about endothelial injury, atherosclerosis is the disease that comes to mind. Atherosclerosis is defined as the thickening in the walls of large blood vessels due to the accumulation of fatty materials. Atherosclerotic vessel disease is the most common way that arterial thrombi occur, and therefore presents a major risk for ischemic stroke. In atherosclerosis, injured endothelial cells enlarge and medium-sized arteries become chronically inflamed. LDLs that are found in cholesterol are retained by the injured endothelium and become oxidized. These oxidized lipoproteins trigger an immune response, which attract cells called macrophages. These macrophages become trapped inside the endothelial lining, forming what we call foam cells. Eventually, the body tries to heal this chronic inflammation, forming a plaque or fibrous cap over the area. If something such as turbulent blood flow causes the plaque to rupture, a blood clot can form, causing a blockage. The clot can also break off and travel into circulation. Let's come back and take one last look at the pathophysiology of stroke. A compromised systemic circulation in a weak heart can also increase the chance of an ischemic stroke. When the heart is weakened, blood does not flow as effectively as it used to. When the flow of blood is reduced, the chance that various clotting factors in the blood can interact and form a thrombus increases. A heart condition like atrial fibrillation is a major risk factor for stroke, making a patient 5 times more likely to suffer one. Atrial fibrillation is when the top 2 chambers of the heart, the atria, do not fully contract. Instead, they sort of quiver or fibrillate. This irregular contraction means that blood is not pumped fully out into the ventricles, and some of it pools and then can clot, and then these clots can be pumped out of the heart and into the brain, causing an ischemic stroke. Returning to a diagram of a blood vessel, let's look at how different injury to the blood vessel can lead to a hemorrhagic stroke. If a patient has high blood pressure, then their arteries are always under a lot of strain, and the blood pushes on the vessel, and that causes the walls to eventually weaken, causing a bulge called an aneurysm. These weakened walls are more likely to burst, especially if they continue to be put under the same pressure as before. If the blood vessel that bursts is in the brain, we call it a hemorrhagic stroke. Hypertension is therefore a crucial risk factor for stroke and needs to be well managed to prevent weakening of blood vessels. The symptoms of a stroke depend on the type of stroke and what area of the brain is affected. As early as 400 BC, the Greek philosopher Hippocrates described the stroke phenomenon as sudden paralysis. He used the term apoplexy, which is the Greek word meaning struck down with violence. Hippocrates had the right idea. One of the most common signs of a stroke is sudden numbness or weakness of the face, arm, or leg, especially when it's on one side of the body. People who are having a stroke can also experience trouble moving due to dizziness, loss of balance, or loss of coordination. Stroke victims may experience trouble speaking or understanding. Sudden confusion is also common. Other possible indicators of a stroke include sudden difficulty seeing, sudden severe headache of unknown cause,